Oh, it's happened a long time ago, almost 10 years. I remember I finished an orthodontic treatment on a patient. She was looking beautiful, perfect straight teeth, but she had a gummy smile. So I didn't say anything at that time, but I was thinking, what can I do to improve her smile? I made some research and I realized Botox is one way to solve the issue. So it all started like that. And also, when I was a student, I used to be a model in Paris for Chanel, Givenchy, and I always had an interest for fashion and beauty. So naturally, I have extended my knowledge in non-surgical aesthetic procedure using softening wrinkles such as Botox, derma fillers, threads, mesotherapy. And I'm injecting almost 10 years, since 10 years now. And I love to provide to my patients the best of non-surgical aesthetic procedures. Natural. They want to look natural. This is the request number one. No fake expression. And I have to say it fits perfectly well with my vision of aesthetic. My vision of aesthetic, okay, let's do a little comparison. I love architecture, and when I travel, I take 1,000 of pictures of building. In architecture, you need to have sense of balance, proportion, precision, functionality as well, as much as a sense of aesthetic. And it's exactly the same in a facial aesthetic. When a patient comes to see you and have a line, you need to look at that line just not as a line, but to integrate that line into what is the face, how is the face, so bone structure, muscle activity, facial expression, when the patient looks face or from a profile angle. Of course, you have to integrate as well the aging process. All that is extremely important. And of course, there is a medical condition, the previous history of the patient you have to take on board. And all that is very important prior to inject. You can't just jump and inject. You need to have all that in mind before injecting. And for example, if you have a line in here on a nasolabial fold, it doesn't mean you are going to inject on that line. Maybe you are going to inject in a different part of the face to give a natural look by dealing with that line. So this is what I like in facial aesthetic. It's to have on mind that dynamic expression, not only something static, to have that glowing and beautiful look. And it's the reason why as well my consultation is usually an hour consultation. The first consultation, as I said, is essential. And it's the reason why it's an hour consultation. And first of all, when I have the patient in front of me, I'm listening to my patient and I'm observing the face. It's very important for me because I can assess the facial expression and understand already a little bit how I'm going to do something on the face. I like to take pictures as well. Picture is very important for me, because it gives me the distance to be able to assess any facial asymmetry and to start to build my treatment plan. Then, when it's done, patient come with me and we look at all those pictures and I try to make it understandable for the patient. According to the aging process, maybe it will take few sessions, not only one session, but few sessions to be able to achieve the result we want to achieve. And I really feel like a painter. You know, a painter has his own brush in a subtle manner to do the best on his canvas. And it's the same thing for me. I don't have brushes, but my brushes are soft and wrinkled, such as Botox, fillers, threads, and with them, because I feel it's a combination of all of them, especially when the aging process has already, there is a certain degree of aging process, it's where I feel I get the best result. Another thing as well which is important for me is, yes, my patient come to fix something, But I like as well to make them understanding taking care of the skin on an everyday basis. It's extremely important. And I like to go through what is your skincare regime. If I can give them some advice, I do. And I emphasize the need of mesotherapy. Mesotherapy is a gentle medicine, and it brings some element to nourish the skin, under the skin, and I would say 1 session a month is ideal. Mesotherapy is a gentle medicine. I call it my deep skincare regime. When, for example, you use a cream on your face, it's never past the barrier of the skin. Even if you spend a lot of money on those creams, it just has a superficial effect. But with mesotherapy, you are able to bring the nutrition element, like, for example, vitamins or hyaluronic acid, which is one of the components of our skin for volumization and hydration. You are able to bring all those elements under the skin. So it's something extremely good because you get a natural glowing skin through mesotherapy. The way we deliver the mesotherapy, it's through, for example, derma roller, which is quite painful, or you can use as well a mesogun. I use the most sophisticated mesogun existing on the market. And with that mesogun, not only you deliver the product, but as well, because you can have multiple injection, very fast multiple injection, you are able as well to boost the production of fibroblasts and increase the collagenase. So it's absolutely ideal, and it's absolutely painless as well for the patient. So the ideal scenario is to have it once a month. I would like to say, if you are still watching that video, so come in, come to see me, and I'm sure we'll find a way together to achieve your dream.